Hip arthroscopy is a very unique procedure, and there's a few reasons why there are not very many surgeons who perform hip arthroscopy. First of all, this is something that really started growing as a field within the last 10 to 20 years. So, some physicians who trained before that may not have ever really been involved in hip arthroscopy during their training. It's approximately 60% of my practice is hip arthroscopy. And we see people from all over South Carolina, all over over the Southeast who come to us with these injuries. When you think of a hip injury and you think of orthopedic surgery, most people think of an elderly patient with a hip fracture, or they think of their uncle who has hip arthritis, who had a hip replacement. But there's a whole group of people out there, a large group of people that have hip pain, and they're not arthritic. They don't have a hip fracture. They're just young, active people who all of a sudden start having hip pain. They feel a click in their hip. They feel a pain that bothers them every time they run. Those are the people that typically hip arthroscopy can help. They can have conditions like labral tears or hip impingement, which is a condition where the ball and the socket aren't shaped perfectly round, and with repetitive motion, they continue to tear the labrum. For years and years, that condition was left untreated. People would get diagnosed with groin strains, hip flexor strains, and you just had hip pain. But with hip arthroscopy, which really started to grow about 15 to 20 years ago, we can help those people now. We can get them back to doing the things they love, get them back to the sports they love, and just really just living a life without pain.